This is 1017 CHLY.
Welcome to Wellness Wednesday and the Chronic Wellness Radio Show. I am your host, Sandra Sova, and I'm coming to you live today from the CHLY studios. I hope everyone's having a really, really fantastic Wednesday. I always refer to these as Wellness Wednesdays, whether I'm here in the booth or not. I always try to make sure that I'm doing some sort of measure of self-care, whether that's for physical or emotional well-being. And it is always great to spend some time with you here in the booth. Today, we have got a really great show for you today. I know you're absolutely going to love it. We're going to be talking about women and girls' health and wellness. Such an important topic. You know what? Here, let me ask you this. Are you hearing and seeing more women being more vocal about our needs, our health, our wellness? You know, we're claiming our power, and we are no longer interested in being told what to do with our bodies and our health. We're making our own informed decisions. And you know what? We're getting smarter about it too. It's a movement and it's picking up momentum and it's building steam. Today, we're going to be talking about our reproductive health, the delicate balance of hormones, the birth control pill, what you need to know about that, and some ideas of what you could do instead. Important stuff for women of all ages. But, you know, especially if you are a parent of young girls, this is something that you are going to want to take a listen to. My guest has a lot of knowledge to bring to the table. And so if you know someone that's struggling with conceiving, we've got so much good info for you today. So call or text a friend. Let them know that this is the time to tune in to CHLY and give a listen. So I'm going to welcome my guest into the booth right now. Joining me here today is Lisa Legere. She is in with me here live in studio, and she's going to bring us so much knowledge. She is a holistic reproductive health practitioner, a holistic health advisor, and very qualified on the subject matter today. Welcome to the show, Lisa. Thank you so much for joining me here on Chronic Wellness.
Thank you, Sandra. It's great to be here on Chronic Wellness.
And so today's topic is pretty darn cool. It is talking about women's health and wellness and a lot of our reproductive concerns, our cycles. This is an area that you've been working in for quite some time. Give us a little bit about your background.
Okay, sure. First of all, I want to applaud you for bringing up the wellness idea because, you know, it's not just... it's not good enough just to be free of diseases. That's not really the ultimate goal. We want to be well, and you're talking about being, you know, vibrantly, chronically well in a way that is optimal for us. And so that's an area where women's health has kind of struggled because we are really not prioritizing that. We're busy holding down jobs, running households, getting kids to soccer, and doing all the other, caring for our friends and relatives and in our communities. So optimal health is really thought to be this kind of difficult to achieve goal.
And absolutely. And like when people think about being healthy as like you said, like the absence of disease, that bar is set way too low. Like, and I think that there's sometimes whether it's the busy lives or just everything, sometimes we may not even be tuning in to even know, are we operating at an optimum level?
So that gives me an excellent opening to tell you a bit about tuning in. So the way that I learned to tune in, of course, I studied meditation and herbs and natural medicine when I was at university. Kept sneaking off campus from my psych degree to go and study massage and herbs and stuff like that. And then when I graduated, I ended up working with some holistically oriented doctors in Toronto that were medical doctors, but they treated with nutrition, supplementation, and natural approaches to healing. While I was there in that clinic, I ran into a woman that was teaching her clients how to chart their cycles. And I was thrilled to meet her because, like most of us, I had struggled with all the various birth control methods and found each of them to be problematic or lacking in some way, specifically in terms of side effects, weight gain, mood changes with the pill, for example, and then pain and discomfort and heavy menstrual bleeding with IUDs. So when I met Geraldine Mattis, my teacher, mentor, and colleague, she taught me to chart my cycles and help me understand the difference between my fertile times and my not fertile times in my cycles. And this method is called natural family planning or fertility awareness methods. It's based on symptoms and changes that occur during ovulation. So you and your listeners probably understand that women's bodies go through a cycle. We have our periods once a month on average. It can change and vary. And there's another thing that happens between each period, which is ovulation. So if you hearken back to your health class review or your sex ed courses from high school, you'll remember that ovulation was the time when an egg is produced in the woman's body. And that, of course, is the egg that gets fertilized when pregnancy occurs. When we can identify the time that ovulation happens, we gain a whole lot of power, insight, knowledge, and agency, because we can then decide whether to become pregnant or not. And this knowledge of identifying ovulation is presented to the general public as this mysterious, arcane thing that you couldn't possibly figure out. And what I discovered by learning to chart my cycles is that it's perfectly obvious when ovulation is occurring if you know what the signs and symptoms are to look for. And so when I learned to chart my cycles and identify my own ovulations, it blew my mind, and I couldn't wait to tell every other woman on earth how to do this. So it became a mission, it became a vocation, it became a something that really defined my career ever since. And that was 30 odd years ago. So since then, I've been charting my own cycles, and I have learned to teach other women to chart. And I've also become a member of the faculty at Justice College, where we teach other teachers now. So I have students all around the world who are learning to be fertility awareness teachers like me.
So that whole thing about talking about tuning in and paying attention to actually the changes that are taking place within our bodies, it makes so much sense. And who better than the person that it's happening to to pay attention to that. And you know, having a monthly cycle is a normal process, not something that needs to be fixed. It's and so by doing that and by teaching other women to do the same, that does put the sense of empowerment and control right in the person's hands who needs it.
Right. Let's think of an analogy. You know, when you eat food and you notice if that food gives you gas or if it settles well in your stomach or not, or gives you the runs or makes you feel constipated or something like that. That's a form of literacy about your body, isn't it?
Yes, absolutely.
It's a way of going, oh, every time I eat that, this happens. Maybe I should not eat that, or maybe I do it a different way and only eat it at certain times. So that's a form of literacy. Knowing what kind of skincare to use on your skin, that your skin seems to respond nicely to. That's a form of literacy or self-care. Knowing which essential oils you respond well to, or that you can use successfully in your life. These are forms of wellness literacy that we can all kind of relate to. And if we understand how our bodies work, we're probably going to be able to live in alignment with them more efficiently and in more beneficial ways. So let's just take that to our reproductive cycles. For some reason, and don't even get me started on what those reasons could be. I think there's a lot of inherent misogyny in our culture, that women's bodies are somehow problematic and icky and complicated and all this sort of stuff. And there's very, very deep underlying reasons as to why we have these notions in our society. But if you put that all aside and just think about our reproductive cycles as just another body function, like breathing or digesting, reproductive cycles become just another thing that we might as well be literate about. And so if we understand how our periods work, what they mean, how to make them, less problematic, and actually using our cycles, riding the sort of hormone waves and the different moods, changes, energy levels, libidos, and all these sorts of things that kind of rise and fall throughout our cycles, we can actually organize our lives accordingly. And like I said, avoid or achieve pregnancy, but also just plain manage. Maybe we don't want to plan a dinner party for the week when we know for sure that we're going to be on our period, because that's the week when we should be lying in the tub reading a novel instead.
The whole thing of body literacy is so powerful and so important. I know for myself, a real aha moment came when I made the connection between my levels of stress and my levels of pain and inflammation, and also being aware of pain in a way to adjust before it gets unmanageable, and all these things. It's like you say, it's like managing through and coping and working with what is being presented to us at that given time, instead of always looking for a Band-Aid or a fix or a solution. Work with where we're at with what we've got.
That's very much a holistic approach. And I know that some of your other guests over the years, Sandra, have talked about this kind of, working with what life deals you. And certainly when you have a chronic inflammatory condition, you have to do that. You have to pace yourself. And when you're having a flare up, then you do the remedies and the, symptom management that is required so that you can get things done in your life and so on. So, this idea that we need to be consistently the same performers at every single day of the week and the month. And, that's really sort of a capitalist idea that we should, present from 9 to 5 and give her every day and so forth. If the world was run by more feminist principles, if there was a more sort of feminine approach to the way life unfolds, we would understand that there's a cyclic nature to our moods, our energies, our appetites, our ability to just present in the same way every single day, and that would be honored. Our needs for childcare, our needs for rest, our needs for time to eat and digest our food and so on before we get back from break. So the world has been set up for profits to be made, for efficiencies to happen, and so on and so forth. And women coming into the workforce, the nature of us having cycles was seen as a problem.
Yeah.
And so the solution, of course, as in so many aspects of society, is to find a Band-Aid or a mitigation for that instead. And so women were invited to kind of suppress their cycles, their discomforts and distractions of their cycles as it would be perceived, and take the pain medication, or in the case of reproductive cycles, it was the pill. The pill became the answer, the solution. So if a patient would present with period problems like menstrual cramps, for example, or heavy menstrual bleeding or menstrual migraines, if those were disrupting her work schedule, making her late or calling in sick, well, we better get some remedy for that, because, of course, the capitalist machine must keep on chugging, right? So she's got to get in there from 9 to 5. So, pill-type solutions in our culture are very appealing. And so I think that there was an attraction to this notion that using hormone treatments would be a way of kind of escaping from these hormone influences and allowing for women workers to become more efficient and more kind of reliable as workers in the cogs in the machine, I guess, if you will.
And then also with the, I think that there's a really a bigger increase in the last decade of young girls being like, people are becoming sexually active at earlier and earlier ages. And, those moms are taking them to the doctors and putting them on the birth control pill as the safety measure to avoid pregnancy. And I think that's happening younger and younger.
Well, and it's to be irresponsible if you have a young daughter, of course, that is a concern. But let's look at the solutions. Let's look at the overall, what do we want to achieve? And I think many of your listeners will agree that proper sex ed has been shown in many other cultures to, in fact, lower the teen pregnancy rates and cause young people to begin sexual activity at a younger age. I'm thinking specifically of research that was done in Denmark and in other countries in the Netherlands, in Holland, where they were able to show that providing informative sex ed actually does achieve those things. In comparison to states in the U.S. where, as we have heard, sex ed is really abysmal, and the rates of teen pregnancy and unplanned pregnancies are much, much higher in those communities.
So thinking of women that are at adult age, they're working, they're maybe started a family, maybe they haven't, and their monthly cycles are coming up each and every month. Do you think that most of the people that are trying to not conceive, their first choice is still currently the pill?
Oh yeah, the pill is very, very popular form of birth control. Yes, indeed. And I've got no problem with that. My issue is the health impact. I don't feel that pill users have been properly informed. So we talk about informed consent, and it's this a wonderful notion. But when everything on the menu that you're shown is a hormone method of birth control, it's really not a lot of choice you're being offered. Fertility awareness methods, as far as effectiveness goes, have recently enjoyed some corrections because the Center for Disease Control in the United States changed the effectiveness rates recently to reflect a difference between fertility awareness methods and the rhythm method. So a lot of your listeners might be thinking, oh yeah, I've heard about that natural birth control method. Sure. I'm not talking about the rhythm method. I'm not talking about what they call a Vatican roulette. I'm talking about actually observing signs and symptoms of the fertile phase and identifying ovulation correctly. And this is different. So what's happened with public health nurses, sex educators, doctors, and medical people who are offering birth control methods to their patients is that the effectiveness rates of both the rhythm method, which is basically a math calculation that assumes when ovulation probably happens, and fertility awareness methods, which is actually looking at symptoms and changes and identifying the fertile phase correctly. The effectiveness rates of those two approaches was all mushed together and called natural methods, and the effectiveness rates of the rhythm method dragged down the effectiveness rates of fertility awareness, which is far better looking when you separate those two out, because of course, as we know, the rhythm method being based on a math calculation assumes that our cycles are perfect and that they happen every 28 days and just like clockwork.
Have you ever met that woman with that perfect cycle that happens every 28 days?
No, I've seen hundreds of charts, and I can tell you that real women have variability in their cycles. The main reason that the rhythm method does not work is that ovulation can be delayed because of stress, illness, poor health, travel, exams, moving house, and all these sorts of things, which is life. Yes. So ovulation is subject to those impacts, those environmental effects on the body. And that is why we cannot predict when ovulation will happen. We just have to watch for the symptoms of it unfolding. And so that's why the method that I teach is superior to the rhythm method. But, this wasn't made clear to medical practitioners. And so they passed on mistrust of these methods as not very effective. And so that's, and then furthermore, there was quite a lot of push toward drug solutions in general. Pills are medical people really love prescribing their pills. So if they could get a young woman onto the pill, then they figured that their job had been done and done, properly, because of course the pill, the effectiveness rates are extremely high. But as my colleague Laura Werschler always said when she was with Sexual Access in Alberta, is we're not serving the clients who come in there and are not interested in a chemical birth control method. And there are women, there's probably listeners today who really just don't like the idea of taking hormonal birth control. Now, who would these women be? They would be likely to want to eat healthy. They would want to likely not use chemicals in their body care products and their home cleaning products. These are the type of people who don't microwave plastic containers because they've heard that chemicals leach out of the plastic into the food. These are women that are probably likely to be interested in ecological matters. They likely recycle. They probably, try to limit their meat, or they try to make sure they get organic food or ethically raised animal foods if they do eat meat and so forth. These women, the pill just doesn't fit into their lifestyle. And so what are we going to offer them for birth control? Well, I have something to offer, which is fertility awareness. And it does fit in with the lifestyle of some people. There are going to always be women who will choose the pill for certain stages of their lives. They may decide to quit the pill when they're going to start their families in a year or two. What are they going to do for birth control during that time? I suggest they start charting and understanding how their cycles work. The advantage to charting is, of course, it can be used to avoid or achieve pregnancy, but it's also a wonderful health record. And you did allude to this earlier, this idea of tuning in, as you call it. And I love that, because when you do journaling or keep a food diary or anything like that, where you're sort of keeping track, you gain agency in your life. In whatever it is, if it's the eating behavior or the amount of sleep you get or so forth. That's why people love their Fitbits and stuff like that. So that we gather information about our bodies, and this, of course, improves our literacy, and it improves our ability to make decisions about what we want to do with that information. So the chart, I've had clients who start out charting because they want to use it as birth control, but what has happened is this pleasant side effect of charting, which is actually learning. Every time this happens, I get this, or start to notice, I'm going to start charting my paydays or full moons or drinking binges or whatever it might be, and start to notice, start to gain insight. I've encouraged my clients over the years to actually chart if they get a treatment or start a new remedy as well, so that they can assess the effect of that. So put down when you go to the chiropractor, put down when you start a new herbal medicine or something like that.
That's
so you
such
can
a great
see if
idea.
it's actually helping.
Yeah, and if you're not sort of making a baseline, if you're not paying attention, we shouldn't just be paying attention to this when our body is experiencing some sort of a crisis. We should know this sort of stuff all the time, because like you say, that's when you can notice the changes. When you were talking about it, it's almost like, the basics of, putting it another way, like tracking a budget. Where's your spending? How much am I spending on food? What about fuel? What about, oh, I didn't realize I was spending that much at the makeup counter, or I didn't know that that's what was going, unless you know where you're at, how are you going to know where you're going to go?
That's my point exactly, is that charting does give you that insight. The other thing about the body and the cycle unfolding as it should is that many of my colleagues have agreed to refer to ovulation or the cycle in its entirety as a vital sign of health. So we're supposed to be cycling. It's how our bodies work. It's a normal function of the human body. And when you suppress a normal function of the human body, there are repercussions to that. So the pill works by profoundly disrupting the endocrine system. We talked about, microwaving plastic containers and how that produces endocrine disruptors, and people are, worried about dioxins and bleaches and all these things that are endocrine disruptors in our environment. And I'm here to point out that the pill is the queen of all endocrine disruptors. That's exactly how it works. It disrupts your endocrine system. It shuts down ovulation. Now, if you think of ovulation as a vital sign of health, just like breathing and having a heartbeat, then you realize that we should really be allowing ovulation to occur in the female body. There are advantages to ovulation. There are benefits to making our very own estrogen, which is during the ovulatory phase of the cycle, estrogen is produced in the body. Now, this is our very own estrogen that our very own body is producing. And it is shown to help with bone density, the lining of the artery walls, brain health, reducing risk of dementia and so forth. So there are benefits to having our very own estrogen.
Which is very different than estrogen from outside sources.
Yes, what's referred to by some of your other guests over the years as xenoestrogens. You've probably heard your guests using that term. So these are basically space alien molecules, estrogens from outside of the body who kind of act like estrogen, but really are not. And that's what the pill is made out of. It's a chemical or fake estrogen. And so this shuts down ovulation, and we don't get the benefits of those synthetic estrogens. They don't benefit us in our health in the same way that our very own estrogen would have done so if we had allowed our own ovulations to occur.
And when you think about it, even just describing it, the fact that a healthy monthly cycle is an indication of what our bodies are supposed to do, just like digestion, just like we wouldn't want to bypass that without some repercussions. I mean, even just, it just sounds so logical. So what are some of the side effects that can happen to us if we are suppressing ovulation and going the chemical route?
Oh, thank you. You're giving me an opportunity to slag the pill even further. So if anyone is listening and you're thinking, well, I don't know if I should go on the pill or not, or maybe it's been 10 years, maybe I should quit, I would encourage you to do so. The pill is, a great way to get through college or, manage a difficult situation for a short period of time. It should really not be a lifelong state to be in. Ideally, we should be allowing our own cycles to unfold. When you take synthetic estrogen drugs, you run the risk of blood clots. There is documented evidence of anxiety and depression. In the pamphlets and information about the pill, it's referred to as mood changes. But these mood changes can be very profound and very disruptive. Young women in college go on the pill. They start to get anxiety, depression. It's not attributed to the pill. It's attributed to her being a young woman at college. She can't hack it. She's homesick, things like this. So it makes me furious when the patient is blamed for the drug side effect. If anybody ever comes into the pharmacy where I work up in Parksville and says, what have you got for anxiety or depression, or, my granddaughter is going through a difficult time, she's crying all the time or can't, keep it together. The first thing I ask is she on the pill? Because it makes me mad when the patient is blamed for something that is a drug side effect, because what happens? There's a note made in her medical records, right? And now she has a diagnosis. Now she has a mental health condition.
Yeah.
And if that was a side effect, that makes me furious. So one of the reasons that happens is the pill can cause depletion of certain nutrients. So I know that you've had guests on in the past who've talked about vitamins and minerals. I know you've talked at length about magnesium, for example. Magnesium is a really important mineral in the body, and it's involved in numerous interactions and processes in the body. They figure something like 400 different metabolic processes require magnesium. And the pill, like many drugs do, causes you to use it up quicker. So there's a risk of becoming depleted. And magnesium, as we know, relaxes the muscles, calms the nervous system, helps you feel more relaxed and sleepy in the evening and things like that. So being low in magnesium is not good. Another thing is B vitamins. B vitamins, as you know, are really important for stress and for, the nervous system. So being low in B vitamins is not good either. And it can have play a role in somebody's mood and behavior. So there's two examples right there. There's another bit of research that I've been exposed to show that being on the pill actually reduces the amount of blood flow to the genitals. So the actual clitoris and structures of the vulva become atrophied. Do you know what that means? You get a smaller clitoris. Who wants that?
Nobody.
Nobody.
Who wants that?
Nobody in my vicinity.
And that will have a direct effect on libido.
Sex life. Yes,
Yeah.
indeed. So she may have more difficulty she might have painful intercourse, or she may have more difficulty with achieving orgasm. Again, who wants that in their life? And again, who's going to be blamed, the pill or the person themselves?
It's the doctor is probably not going to say it's part of the pill, but I mean, when your body is being depleted of those things, cause and effect, and that's pretty unhealthy.
It's significant.
It's sad.
And if it's disrupting someone's personal life, I remember my daughter, of course, tried some hormone birth control methods. You know what daughters are like. They will reject anything that their mom is interested in. So I did get my daughter to chart, but she also dabbled with some hormonal methods as well, until the day that she was having an argument with her boyfriend in the parking lot, and he accused her NuvaRing of being the cause of her bitchy mood, and she reached into her purse and said, "Fine then," and grabbed it and pulled it out and chucked it in the garbage can. And that was the end of hormone use for her. And that was back to condoms and fertility awareness.
So we've talked a lot about the aspect of preventing pregnancy and birth control methods. And, I wish, and I bet you do too, that there at least was a non-chemical option. Like, wouldn't that be nice if when we would go to our doctor's office, we would see like the menu of choices? And I don't think we're quite there yet, but for those individuals, like the woman that you were describing, that is into leading a healthier, active lifestyle, and let's say she's moving into a phase not of preventing pregnancy, but looking to achieve pregnancy. There's lots of fertility issues that people are experiencing.
Oh, that's a good point. Yes. Those textbooks are perfect cycles. My colleague Geraldine talks about how when she started out in her career, and she was teaching women to chart back in the 80s, I guess, women had pretty straightforward cycles, and they just ovulated and had periods, and everything was pretty reasonable. These days, not so much. We're seeing a whole lot more irregular cycles. We're seeing a whole lot more polycystic ovarian syndrome, endometriosis, problematic periods, and anovulation. Women just simply are not ovulating. Some of it is a post-pill syndrome. So coming off of the pill doesn't mean that you click back into perfectly normal cycles again afterwards. There is a period of time of recovery where the body has to relearn how to do this vital sign of health, which is having cycles. If the woman was put on the pill quite young, when she was still in her puberty years, then that's a big problem because she's not even fully matured yet. And so when she quits the pill in her late 20s or early 30s to start her family, she kind of has to almost finish going through puberty, or her ovaries have to learn how to do this response and endocrine feedback loop and this sort of thing. So there can be definitely problems with the post-pill or post-IUD or post-Depo-Provera shot. There's actually support groups online for women that are struggling with injury from coming off of Depo-Provera and trying to regain their fertility. Oh, by the way, the Depo-Provera is a progestin form of birth control, and progestins are, they might even be even worse than synthetic estrogens. They cause a lot of problems. Our very own progesterone that our very own body makes is really a nice hormone. It puts you in a good mood, and there's many benefits to having adequate progesterone levels. And when a progestin is injected as a form of the birth control shot, there can be side effects and long-term harms from that, and it takes a while to recover from that for some women. So we're seeing a lot more of that these days, and not just post-hormone use, but just diet and lifestyle related things too. So there's quite a lot of sugar in the diet these days, and that can disrupt other hormones. So the insulin levels and the stress hormones and the disruption, the impact that can have on the adrenals and thyroid. Some of your other guests over the years have talked about that. I know you've had naturopaths on who are really big on the whole adrenal thyroid connection and that sort of stuff. So these very delicate endocrine feedback loops can be severely disrupted through environmental factors, environmental impacts. So we've got diet and lifestyle, we've got stress, we've got all the other normal things of modern life. And then we've got these very powerful hormones that come in and purposely disrupt the endocrine systems of young women. And I tell you, I don't like it.
No, for sure. And, that's having an alternative, having a solution for the type of people that you were describing. They're into protecting our environment. They want to hydrate with clean water instead of soda pop. They eat healthy. They like to buy organic and move their bodies. Where does someone go about learning a charting system, and is it difficult? Do you need ongoing training, or what does someone do?
Good question. There is a lot of resources online these days. So the Justice method that I teach, we are part of a international group of fertility awareness educators. We're listed online. Our website is justice.ca. That's JUSTISSE. It's the French feminine for justice. And .ca, we're a Canadian-based college. So we teach. We have students, graduates listed on our website. You can find me on Facebook for just some quick advice now and then. There's actually charting groups, support groups online who help each other out. Learning properly does require, it's like learning any other new skill. You need to do it correctly, and especially if you're wanting to use it as a family planning method, you certainly do want to use correct methods, following the rules, having high effectiveness with that. So our graduates are trained to teach how to chart correctly. And for most new charters, they want to speak to a teacher, every few weeks, once a month, for 4, 5, 6, 10 sessions, depending on how complicated their situation is. What makes Justice a little bit unique is that we do holistic health advice and education as well. So some teachers just teach people to chart, but if they run into abnormal charting parameters, they'll refer on to a naturopath or a medical doctor. Our grads are equipped to give advice about natural approaches. So holistic advice about diet, nutrition, supplementation, herbal medicines, and that sort of stuff. We're, of course, trained to triage our clients who need to be referred out. So we know the limitations of our practice as well, and we're able to refer. We work with a lot of massage, abdominal massage. There's our vago and lomi. There's visceral manipulation types of massage to work with the actual organs. We work very closely with some naturopathic doctors, functional medicine doctors. These are medical doctors usually who are very, very interested in the endocrine system, supporting thyroid function, and establishing good nutritional baselines for their patients. And so those types of doctors are often willing to work with us and the client who's charting her cycles, because the chart becomes a diagnostic tool, and it gives us information about what's going on hormonally with the woman's cycle, and also how she's responding to the therapies, as I mentioned earlier.
What I was picking up and hearing that is that there's ongoing education and support to take what is basically, a set of instructions and the things to observe, but by having someone who is trained to be able to help someone interpret it. I know that one of the things that is so common, you can give a list of instructions or protocols for something, but the way, whatever that person's mindset is, how they interpret that can be so different. And same like myself with essential oils, there's a lot of education and safety and things that you really need to know before you just go forward with it. So the graduates that can work with these people, and I guess especially for the first while when they're starting, there's things to, you get the opportunity once per month, because it's a process like that. But the training and support, that's something that I think is really, really valuable.
So there's two reasons why it's done. For one is to improve effectiveness and confidence in the actual method. And then secondly, we want to instill all these good habits, good health and body care habits. So reinforcing, what I find often with clients that I've taught over the years, they can learn the observational routine perfectly. They can be charting ever so tidily and following all the rules correctly. But sometimes they still lack confidence in their own judgment. And so sometimes the meetings are actually about reassuring the woman that she's actually doing it right, and she can feel free to go right ahead and trust her own judgment and what her chart is telling her. It's a really interesting dynamic. And I've seen so many really pleasant side effects of charting in terms of personal growth and development, which is kind of a side effect that you don't expect from a birth control method. Being able to actually communicate with your partner, couples being forced to actually talk about their sex life. This really, it's an opportunity to grow and grow into a deeper relationship with one's partner. And so, it's kind of an intangible thing. It's kind of hard to describe and explain, but I've literally had clients come back dressed in brighter colored clothing and just increase in confidence that you can see. She's showing me her chart. She's saying, this happened, and I know this meant this because And that's when I know, yeah, you graduated, you got this.
Yeah. And that's really powerful just on its own. So many times that I see that a lot too, when people when they finally grab the reins to take on an area of their life and they put themselves in the driver's seat. The insight that comes with that it's like you say, it's such more far reaching than the actual thing. And that's amazing, because it can bring, like you said, a closer relationship with your partner. But first and foremost, it's that relationship with yourself. It's the self-care. It's the paying attention, tracking and charting, and noticing when thing and there's no getting around it. There are emotional mood swings and different irritations and irritabilities that go which are just normal, and being able to plan and recognize and it's almost when you have a better understanding of something, you I think also for yourself have the ability to provide a little bit more grace, a little bit more self-love towards you as an individual, as a whole person. And I mean, it's just that's something, I mean, everyone has not only the right to have that, they should have the desire to have that.
That's lovely. That's very beautifully put. And it reminds me of a colleague of mine, Elisa Vitti, has written a book called Woman Code that's become quite popular. And what she proposes is that we actually ride our cycles. We actually design our lives around where we're going to be in our cycles. So when you're riding high toward ovulation and you got all kinds of energy and libido and, force going on, that's the time to pump iron. That's the time to have your dinner parties, do those things in your life that you really need lots of energy for. And then in the post-ovulation phase, when that sort of PMSy days come along, maybe that's a time to do maybe more quieter activities, like go to yoga instead of the gym, or tackle some of those more quieter activities at your desk or things like that. If you're feeling edgy and irritable, my friend Carolyn DeMarco, a doctor out of the Kootenays, she used to say, when you have PMS or you're kind of irritable, that's the time to kick out tenants or fire employees or things like
use
that.
it.
Sort of use that energy a little bit. And if we kind of, knew where we were in our cycles, we would be riding the wave like a surfer instead of being subject to our hormones. We have this narrative in our culture that we're like victims of our hormones, right? And this idea that, these things came upon me and so forth. And it's very disempowering, I think, for this narrative to be allowed to continue, that this kind, being on the rag is, somehow whatever she's saying can be dismissed because, it's that time of the month sort of thing. One really important point that some of my colleagues have made is, the thing that's irritating you, it's irritating you all month long. It's just that you're saying something about it now. So the socks on the floor, they've been bugging you the whole time, but now's the day that I just can't stay quiet about it anymore.
I cannot, I'm just absolute, the logic of this, it's almost like it makes so much sense. Riding the wave of the cycle, figuring out when you should do what. We do that for seasons. We don't try and make snowmen here in August. We respect the cycles of the year, and when it's raining, we anticipate and we adjust accordingly. So we should with our own cycles, which, as you've said, it's a vital sign of our health. It's our health, it's our wellness, it's our being, and not paying attention to it kind of feels to me like it's a woman being asleep at the wheel. Like, come on, like let's regardless of what you're using for. If you're using birth control, if you need it, what method you're using, regardless of that, that's not the real point of this discussion. This is really a discussion about education and empowerment and choices. We need to have access to choices.
That's exactly it. I think it's useful to chart our cycles regardless of whether we're using it for birth control or even need contraceptives in our lives. So I've taught perimenopausal women to chart, and teenagers to chart, and everybody in between, lesbians who aren't sexually active with a man. They can be charting their cycles.
Absolutely. And
understanding where they are in their cycle could be a very, very useful, especially if the periods are problematic. So another useful insight is if periods are painful or difficult, let's try some remedies and chart so that we can assess the results that we're getting.
What sort of things can, like, so you work at the PharmaSave in Parksville.
Mm-hmm.
So do you see and counsel and help women there, or how do people within our community and beyond get in touch with you, Lisa?
So I'm at the PharmaSave in Parksville on Friday and Saturday. So Friday, drop on over anytime. Friday or Saturday, I'm always going to be there. You can call and make an appointment for another time, and I'd be able to make arrangements to meet someone for a private consultation. But if anybody who's listening wants to just drop in, pick my brains for free, that's when to do it. I'm at the PharmaSave Health Center. It's right on the main drag next to the intersection where you turn to go down to the sandcastles.
Mm-hmm. Good.
They're up now for a little bit longer. August 15th, they come down. So if you're going up to Parksville to check out the sandcastles, drop on into PharmaSave there and we can have a word. If you miss me, just send me an email or leave me a message and I'll give you a phone call.
Perfect. What's your email?
So fertilityfairy@hotmail.com. Fertility Fairy is spelled exactly as it should be, F-A-I-R-Y.
Perfect. Now, Lisa, do you have anything else going on with that you'd like to share with our listeners?
Well, I've been doing public education for a long time. The library in Parksville invites me up for a monthly seminar, hoping to do it again this coming fall. But this fall, I actually have a course in the Elder College program at VIU. The title is A Sensible Look at Natural Medicine. So Elder College, as some of your listeners probably know, is a program out of VIU that targets a 55 plus crowd. And they're sort of community college level courses, mostly for interest. I'm going to do 4 sessions looking at natural medicine. One is on vitamins. One's on food and nutrition, one's on vitamins, herbs, and different conditions. So because of my work at PharmaSave and in this fertility education work, I have a really good grasp on what the natural medicine type doctors recommend. I've known dozens and dozens of naturopaths over the years and many functional medicine type doctors. So I can give you a good idea what they would say or what they would recommend. If somebody comes in and into PharmaSave and says, I've been diagnosed with so-and-so condition, I can, give you a very quick rundown on, okay, well, if you were to go see a naturopath, they would want to do this, this, and this.
So basically helping people navigate through that system and with your experience and expertise. Well, that's just another fabulous resource that you're providing for us here in the community. You do such great work. I had the pleasure of meeting Lisa a couple of years ago when we were both at the wellness shows out in Parksville, and I really do admire and respect the work that you do, and it's just been really lovely having this conversation with you.
Thanks, Sandra.
Yeah, and it's so great. We'll have to do this again. It's a big topic, and I know that so many people have a real interest in it. Before we close off, I of course want to share some of my essential oil education on what we can do to help support us more naturally when it comes to our physical and emotions and the environment, and particularly in with women's health. The first oil I'm going to tell you about is one that's called Clary Calm, and it's doTERRA's monthly blend for women. It contains a beautiful combination of clary sage, lavender, bergamot, Roman chamomile, ylang ylang, cedarwood, geranium, fennel, and carrot seed, and palmarosa. And it's a blend that is great for support leading up to your cycle with any PMS, irritability, cramping, heavy periods. It's also highly supportive for mood during the postpartum time, and it's also generally supportive for any time we're going through any sort of a shift or change, and even hot flashes, ladies. So this is something that you would want to have. It comes in a it's a proprietary blend that is coming in a pre-roller, and you can put it on the back of your neck, on your wrists, or across your abdomen, and use as needed. So there is an amazing fertility support blend. So this is something that you make yourself, a DIY, once you get the oils. And this is something you would use topically, again, in a roller bottle over your lower abdomen, over your uterus, and on your inner ankles, over where the acupressure points for fertility are. And you would do that twice a day. And this has been something that has been resourced extensively by a lot of holistic healthcare professionals and midwives. And the combination for the fertility support blend contains clary sage, which enhances our endocrine system function and balances our hormone levels. Oil of fennel helps to support healthy natural estrogen levels and supports our ovaries. Geranium oil is great for overall hormone function, and it increases fertility and balances our emotions. Ylang ylang promotes a healthy libido. It helps to relax the body and mind. And ylang ylang is also said to be really good for relaxation in our body, to assist with implantation during conceiving. Frankincense decreases inflammation and stabilizes our menstrual cycle, and also is really excellent with reducing anxiousness. And then lavender, everything calming and stress reducing. And bergamot, one of my favorite oils, is for emotionally balancing and supporting feelings of self-worth and self-acceptance. So that's a heck of a lot of oils in that blend, but it's really designed to help our bodies support us naturally when we're trying to conceive. And if you would like more information on that and the number of drops to put in to make that, please message me, and I will send you not only the recipe but a link for how to purchase that. The other two things that I wanted to briefly touch on of anything for our overall health and wellness, but especially if you are trying to conceive, is reduce your exposure to toxins and manage your response to stress. We are exposed to so many toxins, whether it is in our cleaning products, out in the environment, what we're putting on our skin. And by switching out these products, you will immediately benefit by reducing your exposure to toxins, and that increases your cellular vitality. And if you are interested in obtaining any DIY books or information on how to put together your own green cleaning supplies, reach out. I've got tons of that ready to send your way. Managing your response to stress, it is the number one culprit when it comes to hormonal disruption, and especially with things like an increased level of cortisol. Essential oils are a wonderful natural way to help with relaxation, easing anxiousness, calming a busy mind, and feeling grounded. So, there is so much that we can do that is more natural, more holistic, to bring us into the state that we are absolutely meant to be in. I would like to thank my guest, Lisa Legere, for sharing this hour with us here on Chronic Wellness. It is always my pleasure to share time with you. I hope you found the information interesting and inspiring, and I hope it causes you to want to learn a little bit more about your own health and wellness. Wishing you all a fantastic rest of the day, rest of the week, and like I always say, may we all be chronically well.